Welcome to Lesson 7 of the EFN Digital Skills for Nurses. This lesson is all about quality assurance in digital health nursing. Lesson 7 is centered around Core Competency 6, which involves independently ensuring the quality of and evaluating nursing care, and Core Competency 8, which is about analyzing care quality to improve one-on-one professional practice. In the digitalization process and in the diffusion of digital solutions, healthcare personnel and in particular nurses play a key role not only as users but also for the important role they play in accompanying patients and helping them use new technologies. In light of this, investing in and supporting the digital skills of nurses and all healthcare professionals is necessary in this context in which healthcare systems are constantly evolving and changing. Digital skills can help nurses improve the quality of care and healthcare. For example, the treatment of certain wounds through electronic tools. These tools indicate to the nurse which treatment to follow to cure certain wounds, and the follow-up of the wound is documented with digital images. Additionally, treatment plans are adjusted in case of deterioration of infection. The advanced practice nurse in wound care can provide additional advice and monitor the evolution of the wound through pictures taken that can be consulted in the electronic health record. Adjustments of wound care is also necessary with better patient and health outcomes. The slightest adjustment of wound care is documented in the electronic health records, which is the tool through which citizens can trust and consult the entire history of their healthcare life, sharing it with healthcare professionals to ensure a more effective and efficient service. When nurses take patients' vital signs and record them in the electronic health record, an early warning system will automatically activate and propose further actions to prevent the patient from worsening or even prevent CPR. This system allows nurses to always have the patient situation under control, thus guaranteeing greater protection for the patient. Furthermore, the automatic reporting of medication errors allows for a more precise evaluation of healthcare. Indeed, through the mapping of errors, accident and near misses, it is possible to carry out department improvement projects and intervene to improve the quality of care also through digitalization. The aims to develop a working method that questions the care provided, allows the registry to learn from mistakes and works on improving the quality of care and assistance. The COVID-19 pandemic has given an important boost and a significant acceleration to the digitalization process, promoting in particular the use of telemedicine and telemonitoring to improve healthcare. The telehealth programs are an excellent example of reducing the rate of hospitalizations and emergency room admissions. Telehealth programs in fact allows nurses to monitor patients on a daily basis. Through telemonitoring, the admission of patients with severe chronic disease can be reduced in hospital because these patients have been coached, advised and guided by telehealth nurse. Furthermore, telehealth is a fundamental tool for reaching patients who are located in rural areas or for whom access to healthcare is more complicated. Some chronically ill patients may benefit from not having to leave home for every appointment. However, despite digitalization and digital tools can help improve certain situations, communication and human empathy will always remain two essential aspects that characterize the nursing profession. Telemonitoring of patients with implanted cardiac devices such as pacemakers, ICD, radial heart monitor is another example of how digitalization helps nurses in their daily electronic work. Telemonitoring refers to the transmission of symptom scores, physiological data including heart rate and blood pressure, ECG, oxygen saturation, and weight directly to nurses via automated electronic means or via web or telephone-based data entry. These devices are equipped with alarm systems that alert healthcare workers and nurses when vital signs change and it is necessary to intervene to restore the patient's health. Thanks to tools of this type, nurses can guarantee greater patient safety by being able to monitor the situation with greater precision and consistency. Another example of remote monitoring are glucometers, which are used to monitor the health status of patients suffering from diabetes, or other continuous monitors that allow you to locate patients suffering from conditions such as dementia and alert nurses of an event such as a fall. In this case, monitors allow patients with dementia or Alzheimer's disease to stay longer in their home setting and delays possible admission to a residential care center. Another example is teletriage, which are telehealth programs that provide patient triage, that is the assessment of the patient's health status through the telephone or another means of communication, and recommending treatment or providing appropriate referrals to emergency rooms of hospital and primary care offices. This tool helps to support the reduction of emergency room overcrowding. Another example in which digitalization supports nursing and healthcare professionals is the example of geriatric patients being screened in the emergency room for antimicrobial resistance. After this screening, the nurse on the unit is directly and quickly notified of the result of the screening and immediately knows which safety measures are necessary to implement. Droplet isolation, contact isolation, air isolation, reverse isolation. Furthermore, these measures will be enrolled in the nursing care plan in the electronic health record and will be signed off by the nurses. Through digitalization and digital tools, not only the nurse will be notified of the measures to be taken to avoid contamination, but also the entire department, so the necessary isolation measures can be taken at all times. The process of digitalization in the healthcare sector is changing the way care itself is delivered by nurses in primary care, hospitals, and community care. The ISBAR method is a digital tool that facilitates patient transfer and ensures that no step is overlooked. This method is based on identification, situation, background, assessment, and recommendations. Digitalization provides a complete picture of the patient through the use of the electronic health record. Oral patients and offs during nursing shift changes can be done digitally and can also be used at the bedside to engage the patient and the family. As such, nothing will be overlooked and the transfer is complete and up to date. In a more and more digitalized world where innovation runs fast, the nursing profession cannot lag behind. To make innovation a reality in the healthcare sector, nurses need to advance in their profession and to acquire new skills and knowledge to lead change. Furthermore, engage them in the co-creation process of digitalization is an essential starting point for creating something that can provide a real benefit to frontline nurses and to the entire healthcare ecosystem. In this context, education is key. Indeed, to promote quality healthcare, it is necessary to have highly educated, dedicated and skilled workforce. Specifically, promoting advanced role for nurses and social workers within integrated ICT has been shown to increase the quality, safety and cost effectiveness of healthcare provided. Furthermore, to develop advanced roles for nurses and social workers alongside e-health solutions, it is necessary to develop new skills and knowledge through targeted education and relevant training, focusing on interprofessional training. The guidelines on advanced role developed as part of the ENSA for Care project shows a set of consensus-based training requirements that can help ensure staff are adequately prepared to respond to any changes in role and responsibility and make the best use of technology provided to support you in delivering care. Thank you all for following Lesson 7 and see you in Lesson 8 that will give you deeper insights on the impacts of digital healthcare.